Hello guys, it's Dr. Arshad Nadeem Awan here with the ultrasound and radiology teaching video. I do hope that you'll all be doing great. I'm going to talk about the parasellar meningioma today, which is arising from the dura mater of the cavernous sinus tuberculum. So this parasellar meningioma will give rise to symptoms of the visual disturbance and the cranial nerve palsy. However, its radiological features are concerned, you may be able to see a well-defined and enhancing mass. It will appear as an enhancing mass in the cavernous sinus, and the second important sign would be that it will cause the or it will encase or narrow the cavernous sinus internal carotid artery. So these two would be the leading signs, being an enhancing lesion in the cavernous sinus. So how we will appreciate this suprasellar meningioma on the images? Let's start watching these images. This is the example of the parasellar meningioma, and this arises from the dura mater of the cavernous sinus tuberculum or dorsum of diaphragmatic sella. So this is how it will appear on the image. Most of the time it will give rise to some cranial palsies or visual symptoms. So a strongly enhancing mass can be seen here, expanding the cavernous sinus. You can see that this is what the cavernous sinus is, and in some time it encases or narrow the cavernous sinus internal carotid arteries. The above sections are post-contrast and sagittal sections of the MR and indicating parasellar meningioma. You can appreciate that post-contrast, it's enhancing mass and it's also expanding cavernous sinus. It is also encasing the internal carotid arteries, which is within the cavernous sinus. Another example for the parasellar meningioma, again you can see that this is a strongly enhancing mass. The first point, and the second is it is expanding the cavernous sinus. And on the third point, because this is the area of the internal carotid artery, so it will narrow the internal carotid artery, and it will also encase the internal carotid artery. So this is what parasellar meningioma will look on the CT images. Parasellar meningioma, as the name shows, its location, and it arises in the cavernous sinus and from the dura mater of the cavernous sinus tuberculum especially, and as a result it will enlarge the cavernous sinus, expand the cavernous sinus, and internal carotid arteries which are in the cavernous sinus, it will be encased and it will be compressed and it will become narrowed. So this was all parasellar meningioma. It's quite easy to diagnose on the images if you know all the pathology about, and if you have seen all the cases before, so it will no longer be difficult for you. So this was all about the parasellar meningioma. With some other new informative video, we'll see each other. Till then, take great care of yourself. Thank you very much.